Welcome, my friends, to the Bob and Brad podcast. My name is Mike Kienitz, and I'm a PT assistant. Today, I am interviewing Dr. Abbasi, who is one of the nation's leading spine surgeons. He works for Inspired Spine, based out of Minnesota, but they also have locations other places throughout the country. He specializes in minimally invasive spine surgeries and was one of the most experienced surgeons that performs the OLIF procedure. He is also the only surgeon currently performing the minimally invasive thoracic interbody fusion. So without further ado, here's Dr. Abbasi. So we're going to talk about osteoporosis in surgery. So how bad does osteoporosis need to be before you cannot perform surgery?
Now let's talk about first what osteoporosis is. When we are born, we have nice young bones and are made of lots of cells going there, building practically a meshwork of tissue, and then we deposit calcium or calcium apatite or some minerals in that meshwork to make it stronger. Like imagine you put a meshwork of metal and then you pour cement in it, and then you have this fantastic concrete structure that is very strong. Now, our body is a living thing. Constantly we put material in and out. That material that we put in and out is mostly some calcium minerals. And when we get older, unfortunately, we take more out than we put in. That becomes like a very porous, very not solid concrete. Imagine that it doesn't take much pressure. It cannot, it's not very stable. Like when you fall, it's more likely that you break your bones when your bones don't have as much calcium as you were when you were in your 20s. Unfortunately, that's a process that happens to everybody, especially if, females, ladies, after when they are in their 50s, 60s, 70s. That process is accelerated, and that weak bone is called osteoporosis, or if it's worse, we call it osteopenia. And that makes the bone weaker as general for any kind of stress. Now, that's not the only problem. One of the major problems of the spine surgery is that when we cut the muscles that are around the bone, we reduce the amount of the blood supply to the bone, because this blood supply of the bone is through surrounding muscles. And in a regular surgery, we literally strip all those muscles. We fillet the bone, and then that bone doesn't get enough blood supply. As a matter of fact, in a regular surgery, when we go from the back of the spine, we reduce the vascularization of the bone to 25% of the original value, because we remove 75% of the muscle and vessel that bring blood and nutrition to our bones. That is bad for any kind of situation, even if you don't have osteoporosis. But if you have osteoporosis, literally that becomes an unhealable situation where your bone is weak and it doesn't get enough blood supply to heal afterward. So there is not one certain value that when we make a decision, this is too bad for us to do surgery. But we know that people with osteoporosis, they have a lot more problem after surgery. Now, it happens to be that after our surgery, we don't cut the muscle, we don't reduce the blood supply. So patients with OLIF procedure have the best chance, best odds of recovering after the surgery. But still, that is a decision that the patient and the doctor make together based on what kind of surgery is needed and how bad the osteoporosis is. Whereas for open surgery, practical osteoporosis, it's better not to do the surgery with a minimal invasive, what we call muscle sparing. There are some other method of muscle sparing technique where we don't cut the muscle in the back. But those surgery is still an option, but it's an individually tailored kind of approach for patients' problem.
Have you ever worked with someone with a compression fracture?
Very much so. I just had 3 patients today that have compression fracture that I saw in my clinic. Right now I'm in clinic. This is a very common situation. Compression fracture, if you imagine that our body, our spine is made of bone and disc, and when the bone become weaker with osteoporosis, if you fall, the bone collapse in themselves like an accordion. They compress and become less, the height of the bone become less, and we call that compression fracture. Unfortunately, that's a common situation. And many of these patients, obviously, the bone doesn't become bigger anymore. So people shrink actually with time. But many times, beside that, they have maybe initial pain and it gets better. Many of these patients I treat, I put them just in a brace. Sometimes, if the bone compresses to a point that the healing is prolonged or pain doesn't go away, we even go in with a needle that is a thicker needle, but we put it inside of the bone, and we put a kind of plastic that becomes a fully hard plastic inside of your body. We call that polymetamethacrylate, and that helps many of our patients. Inside of your body, we strengthen the bone, and the pain goes away. So in some cases, there's not enough bone to do that, or the situation is worse than that. Then we fuse the back, meaning that we add metal and other material that bridge the weak bone, so your weight doesn't go all through the bone, and that is a fusion. Thankfully, not most of these patients don't need that, but if they need that, not cutting the muscle and the bone is the best way of treating them, because that would add more damage to the already damaged tissue.
Okay. Yeah, I worked with a woman once years ago who had the procedure where they put in the plastic type material to hold in her compression fracture. She had all sorts of back issues.
Yeah, that is exactly the second thing I described. Beside bracing, that we go with a needle, we add some kind of plastic inside of that procedure is called vertebroplasty or kyphoplasty. That is a commonly performed procedure, and we perform that procedure as well.
All right. Where can people go to find more information about you and your clinics, and where they can sign up to meet you?
Well, it's actually, if you just put these 5 letters, OLLIF, double L, you will see that 90% of the material in the internet is what we put out there. They have published paper. And if people go to YouTube and put like OLLIF, you will have 1,200 testimonial of patients who have been treated. And I pick the average of everything, like literally you can sit in front of the YouTube and go hours down, scroll down, and you see our patient. Put your condition like OLLIF spondylolisthesis or OLLIF elderly, OLLIF spondylolisthesis. You get more testimonials, informational material regarding that. Or they can go to inspiredspine.org or inspiredspine.com, and they get all information regarding us. We get, in average, about a dozen of patients every week from other states that we go online. And long before people knew about the Zoom and before COVID, we have been having this Zoom and internet consultation helping patients all across the US and even world.